All right, welcome back. Just as promised, we are picking up exactly where we left off. Without further ado, let's get going. After you get out of the hospital, and how long did you, or were you able to just not go back to work and all that until you had to or decided to? Like you said, 6 months or so. Like is how you felt
Oh,
better,
no,
but
I
did
went
you?
back to work, like, a week and a half or 2 weeks later.
But it was it
I'm
was it from home or in office
Yes.
or
Yeah, I'm a
okay?
headhunter. I started with the company I'm with now. I started in November of 2019. The week that I signed with, my business partner and decided that I was gonna join his team was the week that my scans showed that I had growth. And I remember calling him in tears, and he said, "Whatever you need, Katie, we've got your back." So that's when they ordered the PET scan. The PET scan looked like it wasn't looking like things were active. And so everything got kind of put on hold. So I had started my job in November of 2019. Um, we were always work from home pre pandemic, and things were just starting to get moving for me right when the pandemic hit, and then everything fell off because it's I do staffing and recruiting. Nobody was hiring, and so it's not, by November or by September of 2020, still nobody was hiring. So it's not like I didn't, I'm an independent contractor, so it's not like I had to like go on leave with work. And I had maybe like a couple of things going on, but my partner covered for me. And then when I got back, I started working again. And for me, work has been something that just gives me clarity and continuity of just the normalcy of life that we crave as cancer patients. And my boss is an incredible human being and has always been so supportive of whatever it is that I'm going through. So I could have taken 6 months and he would have been fine, but I'm also in sales. So if I'm not working, I'm not earning.
Yeah.
And so for me, it was, I just kind of got back on it. And I think the first couple of weeks I maybe worked part time. I don't work on Fridays. And I was just working to, again, give me something to do and keep me distracted from what was happening in my life. And then my scans, I think the first set of scans were 6 weeks later, and I went back to Pittsburgh for that. And those were good. I think there was really nothing significant, which you don't expect 6 weeks out. My next set of scans, which then would have been maybe 2 or 3 months later, from then on, all of my scans I've been able to do here in Denver and not have to go back to Pittsburgh. But my next set of scans showed a decrease in my tumors. So we were excited at what we were seeing. My TIL activity, my blood work that gets done every time I have scans, was really exciting for my doctor. I'm coming up on 5 years out from TIL, which is bananas, like you as well. It's crazy. And I still have a high level of TIL activity in my blood work. And he tracks every single cell, has like a coded UPC um,
Yeah.
way of tracking it. And I have this one sort of super cell that is still really active. And that's kind of what they're studying in the lab, what they're trying to understand. So throughout the following year, we continued to see decreasing, 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 with the exception of this one tumor that was growing. And so the doctor was just like, his mind was just boggled. Like, what is happening? Like, why is she responding so well, but this one tumor is growing? But the tumor was like hollowing out from the inside. And so it would kind of like started looking like a donut. And my doctor was just like trying to understand what was happening. So a year later, August of 2021, my doctor said, I had scans. We're going over the results on telehealth, and he said, I want to surgically remove this tumor. I want to get in there. I want to know what is going on with this tumor. So I want to have you come out here for that. And this is going to be a really big surgery, Katie. And I'm like, okay, do you want to take all the cancer out of me?
Yeah.
I'll do it. So, and to my roots of no Googling, I delegated that to my sister. My sister is a GI nurse, and I said to her, "Can you please Google like major liver resections and tell me what I need to know? Like, but I don't want to do it myself because I'm terrified of what I might read. So
Right.
she helped me understand how to prepare. I got this awesome wedge pillow, which really helped me because you can't, after a surgery like that, you can't like lay down. It was tough. It was a big surgery. So I went in for that surgery in September. Almost it was a year and a day after I received the TIL. And I went in, and it was supposed to be like a 4 to 6 hour surgery. I think it was a little bit longer. My brother lives in Washington, D.C. My husband went with me. My brother drove in from D.C. and hung out with my husband. I had named the tumor Uncle Fester because my doctor kept referring to the tumor as this festering
Festering.
problem. And so Uncle Fester was his name. They cut an 11-inch incision in a J shape in my on my abdomen. The surgery ended up lasting more than 6 hours. So of course my husband and brother were like kind of nervous. What's going on? I think it's just as hard for the family members to sit there and wait while you're in these treatments, while you're in these surgeries. And when I woke up, I had this incredible nerve block. So I was feeling great the first day. And Nick's sitting in the corner, and I wake up and he comes over and he said, "They got it all. And Katie, you are no evidence of disease." And the doctor had said, Dr. Kamula had told us the day that he said he wanted to remove Uncle Fester, there is a possibility that we could be rendering you no evidence of disease. And for someone like you and me, Chris, like that is the dream, and it feels impossible. Like when you're in it, it feels like all you're trying to do is survive. I had always, of course, secretly hoped for it, but I was never super verbal about it or vocal about it because because it seemed so impossible. And so it was next level hope that going into this surgery, but it was also like a really big surgery. He removed half of my liver. Um, and we celebrated and we're so excited. Everybody at this point, I was like very, very open about my cancer journey. Caring Bridge has been our main means of keeping people informed, and everybody was so excited. And I was excited. Of course, I was excited, but I was also recovering from the toughest thing my body had ever been through. I mean, recovering from a surgery like that is no joke. And as soon as that nerve block started to wear off, I was in a world of
Oh,
hurt. It was hard coming home, getting through the airport, flying home. We almost exclusively have flown Southwest because of the flexibility that they provide in changing flights, when
yeah.
you finish an appointment early and you can fly home early so easily. And I told them when I got on the plane, I was like, "You guys have carried me all over the country for treatments, and I'm getting on this plane without cancer, and you're taking me home without
Did they make an
cancer."
announcement over the intercom
I
for
feel
you?
like they did, but I have chemo brain, so I don't remember. But the flight attendants were awesome. I have a really good friend. I actually met her in Ireland studying abroad in 2020 or 2002. She is a flight attendant for Southwest. And so every time during the pandemic that we had to fly, I would text her my flight and she would contact the crew, and
Yeah.
they would let us they would save the front row for us. They would let us board last so that we were on the plane for a shorter amount of
Yeah.
time. They were just so good to us. And so it was really cool to like have them carry me home that last time, with that incredible news. And then again, it's recovery. So you focus on that. And I think that I came and my work was awesome. They covered for me. I think like a week or two later, I started work again. The morning I started work, I am hemaprona, which is my fake word for being prone to hematomas. But I've gotten like 5 or 6 hematomas over the course of everything. And I had a hematoma. My shirt felt cold and I looked down and I was actually bleeding. So I had a hematoma and it had found a way out through this little prick in my stitches. And so I quickly called my doctor. My doctor and I are now on like a texting, FaceTiming basis.
Yeah.
And he says, "You have a hematoma. Can you get into a surgeon today? Do you know anyone?" I always save phone numbers. So if I ever get a doctor's cell phone number, I save it. I don't abuse
Yep.
it, but I have it.
Yeah.
So I started going through and I texted Dr. Hovland, who was the doctor who diagnosed my cancer when it was contained in my eye. And he said, call this surgeon. I told him you need to get in today. Call them right now. They can get you in this afternoon. So I get in and it turns out I have this hematoma. And so he has to like try to get as much out as possible. I bled for like a week and then it
Ah.
resolved itself. But anyway, yeah. So, but I made it to my morning phone call and I told my boss afterwards, I'm like, yeah, so I'm like bleeding. Into the call and he was like, wow, I'm impressed. And then that was sort of, so I had to physically recover from that. And then I had to emotionally recover. And I think that's something that just is
Yes.
not talked about in the cancer community. I just experienced these crazy mood swings again. And that was, my liver is like regrowing and has just been completely attacked. And I was so emotional and I was really irritable and I was really happy. And then I would get really sad. And I had never experienced survivor's guilt before. And all
Wow.
of a sudden, like I knew what that was. And I think the reason I never felt it before is that I never identified as a survivor. I always called myself a thriver. That was the word I used when I was in it. Is I'm a cancer thriver, and suddenly I felt like I could say I'm a survivor, and then you've got this community around you that you build and these friendships that you form, and you're losing friends and I have so many friends who are fighting for their lives who have children, and I lost my mom to cancer when I was 15 and I know that impact. And so it just it became this total mind fuck where I had to then learn how to process all of these emotions. Thankfully I have an incredible therapist. She's a cancer survivor. She actually emailed my siblings the day of my surgery and just said like, this is really great news, but like I just want to warn you guys, Katie will never go back to the girl she was, to the person that you know, and she is now going to go through this incredible journey of sort of coming to terms with her, who she is now, and you need to just meet her where she's at and know that like she'll put on to everyone else in the world this like great front, but my siblings and my husband and my parents, those are the ones who get the brunt of like what I'm really feeling and what I'm really struggling with. And so I'm thankful to have her, and I'm thankful that she had a relationship with my siblings to be able to say like just tread lightly with her and be
That's
gentle with
incredible. I
her. Yeah.
mean, I remember my oncologist because I have the recording of it. This was like I want to say it was in April of 2019. So definitely way before I did TIL, I was still at the other institution. But he actually had asked me at that point how I was doing, not like physically, but just emotionally, mentally. And I was on this palliative pack of pain meds, and same, like it's almost word for word for what you were just described as being a thriver. I wasn't. I was just like, yeah, I'm thriving through it, and I'm excited to get this treatment done and that one. And he had described it as being in kind of like almost the eye of the storm, or not even, maybe
Mhm.
even in the eye of the storm. Eventually, I'm going to go through the other side of it and then make my way on the out of it. And at some point it's going to catch up with me. And he mentioned the toll it takes on my family, and they were the biggest support for me, like period, across the board. And I say this a lot, but it's almost worse on a patient's care team and as their
Mhm.
family than it actually is for them, because they're the ones that are like really seeing it from a different point of view. And
Everyone's
after
checking on us.
yeah. and
And
then
that like, and also we have some like there are some fun drugs involved.
No, yeah. I mean, I was like, look, I'll do whatever you want me to do. I just do not want to be in pain, and but I was one of those things to where I had to stay ahead of it. So I got used to just being on this palliative pack of narcotics, and
Yeah.
I. It wasn't like I needed to wait for it to kick in before I took it. And so, but between all infusions and systemic treatments and radiation and all this and that. It took its toll on me. And after I got done with TIL and my scans continued to be, even better and better until they eventually were like, hey, we think you have a complete metabolic response. And, uh, what was showing up on my CTs, they could tell were necrotic or calcified. And then it was like, let's
Mhm.
do some PET scans to see if there's any uptake. And there
Yep.
wasn't. And so it was literally about a year after I did TIL, and that's when I started to finally start weaning myself off of the fentanyl and a lot of that stuff. And then, but I had back at work, I was doing all this and that, and then finally I was felt like I was on the other side of the storm. I made it through the eye and then through the back side of it, and then it did catch up with me. And
Mhm.
I had tempted to go to therapy virtually. I eventually did it in person. I was seeking out those that had uh, knowledge and experience with cancer survivorship, and it felt so much uh, like I was spinning my wheels trying to explain both my disease and my treatment because they were both like foreign languages, and I wasn't really getting what I was wanting to get out of it. And I live alone, so I can't. There's not like I come out home and have the checks and balances of being able to, how was your day, and then let me kind of do that. And the whole pandemic thing mixed with my recovery, it took its toll. And I mean, I eventually, like in a few months before I met you, like I got let go from my job and I just crashed, and uh, once I met you, I was like, wow, like one, here's another person that's done TIL, has a rare melanoma. Even though, you did TIL after me, you were diagnosed longer than me. And
Mhm.
so that long-term survivorship, I was like, well, that's fucking badass. I used to be a recruiter. I recruited senior level independent SAP contract consultants. And so I was like, but you're up here speaking. And I asked the people at UC Health, I was like, I want to speak. And so I was like, how do I do that? And I got to give you the credit. You were one of the reasons why I was like, well, shit, Katie's doing it and she's, kicking ass. I was like, that's what planted one of the seeds in my head. I thought about it before, but I hadn't actually like seen another TIL therapy patient like speak. So I was
Mhm.
like, oh shit, that kind of planted the seeds. In that following March is when I got my LLC. And then you were also, I got to let everybody know, Katie's the one here that coached me with, my speaker's contract and kind of that sort of thing. And I think I finally met you. I saw you again at the Denver Gala. Was that the second time I met you in person? I think I've met you
I
in
think
person
so.
like 3 or 4 times. And so I was like, well crap. And I love following a lot of your, specifically on LinkedIn, because that's where I spend like 90% of my time. And like, I just geek out on learning about cell therapies and everything. And one of the things I kind of want to highlight about your TIL versus my TIL is the TIL therapy that I do. Like, it's an exclusion to have uveal or ocular melanoma, and where you went to UPMC, they're like the main place for anybody with uveal or ocular melanoma to do TIL at. And I
Dr.
sat,
Kamula has dedicated his entire
yeah,
career to uveal melanoma.
he was at the at the
Yes.
gala where I got the Courage Award. We sat next to each other the whole night, and when we started talking about it, I mean, I could have talked to him for like 3 more days about my TIL, but
Oh,
uh,
he's
you,
so smart.
he is just like, wow, like I love hearing about your process and everything. And I've talked to some of his other patients, and they had reached out to me and were like, did you have to do an apheresis along with your resection? And I was like, no, but I know a lot about apheresis because
Yeah,
I'm very
I did know
connected with the
this.
Blood Centers of America. And I didn't know that was a part of the process, along with the resection that differs. But the same thing, you still have to do a lymphodepletion, bring your white cell count down to zero, and you still got to recover. But I started doing what I'm doing because I want there to be is just as much focus on the survivorship act or survivorship and recovery post, making it through your last treatment. that there is leading up everything to that. And so that way quality of life is still kind of ensured.
Mhm.
And I feel there's not enough talk about cell therapies or the financial, direct and
Mm.
indirect toxicities, the toll it takes on your family, your mental health, the resources, like all of that stuff. And you also had brought up that Facebook group I started, which I probably need to text you a little bit more about, but I think I'm going to need some help with like another admin. Now, and you were literally who I was thinking. I was like, I wonder if she'd be down to do that. So,
Yeah, I mean,
chat with you some more.
it's been really cool to see. I have a love-hate relationship with social media, and I really struggle because I like for my mental health, I hate it, but it is where I connect with patients. And I've also had, as a patient advocate and patient advisor, I've had to learn sort of what boundaries to set. Um, because it often happens that people pimp me out. They're like, "Oh, Katie survived cancer. She'll talk to you." And I cannot. I just like there aren't enough hours, sadly, in the
Yeah,
week with how many people are getting diagnosed with cancer to be able to talk to everyone. And so what I've done for myself to set some boundaries is, if you are ocular melanoma, I will talk to you. I can help you. If you are a brain tumor that's not related to melanoma, that's not my wheelhouse. I don't have the connections. I have written articles, I have written blog posts, and I point people to that. I have written out my entire clinical history on a blog. And I just got texted today by someone who's the daughter of a woman who was just diagnosed with ocular melanoma. And she said, can we chat? And I was like, yep. She said, we want to know what treatment you've had. And I was like, cool. Here's my blog post.
yeah,
Because what was happening was I was repeating myself and I was
yep.
retyping it up. And so I've tried to streamline so that I can make it as easy and accessible. And I've shared it in the Facebook page where people are like, well, what do I expect? Well, here's what my experience was. Here's my blog post of what to expect on TIL therapy. Here's my packing list on what you need to stay in the hospital for that long.
That's your
Things
Caring
like,
Bridge, right?
no,
Is
that's on
that's a
my
separate?
Future Happy Self blog,
Okay,
um, www.futurehappyself.com. And
okay,
that packing list has things like, you need a long cord for your phone to be plugged into the wall if you want to be able to be on your phone. And it's little things like that. And
yeah.
so I'm trying to um, make it easier for myself, but also make it easier for everyone else to access this information. And then if it's melanoma or TIL focused, I'm also more open to talking, because I'm in the melanoma family. I know a lot of the players and I know people at MRF, and so that's one where I will try to help. I had a good friend get diagnosed with brain mets, unknown primary, but they suspect it's cutaneous melanoma, and I was helping her navigate on who do you go see. And so I call it trauma informed wisdom. It's an Oprah word, but I have this trauma informed wisdom and I don't want to hoard it. I want to pass it along. And so if I can help people, I want to share that. And I started doing my speaking when I got the Courage Award from the Melanoma Research Foundation in 2017. And I realized that night, as I stood there on the stage and shared my story, I was like, this is it. Like, I want to do this. And so I really, really, I love sharing and taking what I've learned. And I think that people in the field crave that patient story, people who are working and serving the patients, but not always interacting. They want to hear the impact. The work that they're doing
Yeah,
matters.
proof
I
of concept. They gotta
it, like
see it.
it it is, you have an impact, and here I am, like, because of you who works in billing at a hospital, because of you who works in logistics for clinical research, all of these people who are working in this field, the researchers, the scientists. I am devastated at what is happening with our current administration, not to go political, but clinical research, the continuity of clinical research is imperative. And if we have this funding cut, it is going to set us back years, if not decades. And the thing about very interesting thing about TIL therapy and my family is that when my mom died of pancreatic cancer in 1997, the week she died, she was supposed to fly to California for an experimental treatment that, when it described, sounds like TIL. Like it
Take a
is,
tumor out, grow the cell into the billions, give
yes,
it back to the patient.
this stuff has been studied for decades. They're still figuring it out. One of the other interesting things about TIL that I think is important to note is that not all TIL is created equal.
Yep.
Not everybody who's doing TIL is doing it the same way.
Yep.
And so you can't really compare apples to apples on Dr. Kumula's research and another doctor's research. It's all different. Kumula 10 years ago made the decision when he was studying TIL that he was seeing that uveal melanoma was getting no research, no funding, no, like because it was so incredibly rare. And cutaneous melanoma was getting all the attention and people were making progress. And so he said, I'm going to focus on this family and try to get progress for the people in this space. And so he is my hero. I have a lot of heroes in my
Yeah.
story, but he is one of my heroes. My caregivers, my dad and my husband, are my other two big heroes of recognizing that this needs more attention, and he has devoted his entire career to that. And I think, like, I don't know if you do links when you do the posts, but
Oh
he
yeah.
was in the Washington Post
Yeah.
in April,
I read
and
that.
that's what sparked them doing a story on me that came out in January. But
That was the
um,
Washington Post article, right?
yes, yeah.
Yes.
So
Yeah.
they
Okay.
did one on him, and
And
then
then
I
followed it up
got
with, yeah.
interviewed for that. And after that interview, the journalist was like, "I want to like highlight her story, not take away from
Yeah. Make it
the
separate.
work that he's done." So it became two separate stories. But Kamula's study is like 33% effective, and for a cancer that has like basically palliative care options, that is worth exploring. The other big thing that I tell people is, and you touched on this earlier, if you do certain treatments, you might be ineligible for other treatments. And
Yep.
so you have to be incredibly careful and strategic on how you decide what treatment you're going to do. If I would have started on Yervoy and then gone to Sloan Kettering, I wouldn't have been eligible for that first clinical trial, which bought me time. With stage
Yeah.
4 cancer, all you want to do is buy more time. So I went from, in 7 months, from no tumors to 12 plus, like rapid aggressive growth. And then for the next 8 months, I was stable. So it didn't ultimately work because I ended up getting growth again. But for 8 months, it bought me more time. It stabilized me. And then
Yes.
more treatments are becoming available. And so it's important to just take a step back, get your second opinion, get your third opinion, grow your team. And then every time that you're making a decision, you're being
It's
careful and
chess.
knowing.
You're
Yeah,
playing
it
chess, not
is
checkers.
absolutely. Yeah,
You're playing
absolutely.
chess, not checkers. I wanted to ask because I remember seeing this on your LinkedIn thing. Are you supposed to be publishing a book? Because I thought I saw a link that says, for updates about my book.
Yes.
Uh,
So I have written a book and I am working right now on getting it out into the world. So stay tuned.
Self-published, or are you going through a publisher?
TBD at this point. But
Right
yeah.
on.
And I finished it in January of 2020, and I was like gung ho, like ready to get it done, get it out. And there was something in my gut that was like, just slow down,
Wait.
Katie, just wait. And I'm so glad I did, because it's just a way better ending than it was before. Totally different story. It's changed quite a bit, and it's crazy because I've been working on this book for 10 years. It's
Definitely have to do another episode and follow up on that, and maybe we can go on a speaking/book tour together,
I
for
know.
rare
Yeah.
melanomas, TIL therapy, and
Yes.
speaker author, uh,
Yeah.
kind of a thing. I think it would be
Absolutely.
incredible. So
Well, I appreciate the work that you're doing and that you're bringing people together. And it's, with the TIL group, it's just such a place of hope. Like I also find it so fascinating that like not like we all come with different cancers,
Yep.
and
And
this is it's
that's
precision
the beauty
medicine.
of it. Yeah.
Yes, it's
I ended up changing the name of it just from TIL, tumor infiltrating lymphocytes, to TIL and other advanced cell and gene therapies, because some of the people that I'm interviewing, I did one that had carcinoma. And
I've never been able to say that word.
yeah, but I'll say her name, Melinda Bikini. I recorded her. She's a 15-year survivor. She did TIL, I think, in 10 years ago. Um, and then also I have another patient that's signed up to do a talk with me, and she is a CRISPR, or she's a sickle cell survivor, lifelong sickle cell patient, but she was the first patient ever to use CRISPR gene editing, and it cured her. But
Wow.
been able to connect with CAR T patients and but TIL therapy patients from multiple different cancers that have hit me up in the DMs: lung cancer, breast cancer, cervical cancer, asking this. That's why it was one of those things where if I'm focusing on the treatment and not specifically the disease, then,
Mhm.
I can kind of, we can kind of pull, because there wasn't a space for that. So it's like, well, start one, and then it's, it's whatever's clever. And I'm the same thing with you. I'm a peer connect for a couple of different organizations, but it's like, if they don't have mucosal melanoma, I'm probably not going to be much use to anybody else, because I'm very specific about mucosal.
Yeah.
And then so it's like, if they're, they check these boxes, then yeah, I can weigh in. But it's a rare thing for somebody within our age and our survival to, one, exist, but two, that it's out there talking about it. So it's another
Yeah.
thing about, hey, like, let's get together and have some conversations, and maybe the next person that hears this at some point gets a diagnosis for whatever, they at least have, hey, I remember hearing, ask about this,
Mhm.
there's a few things that they knew, that they didn't have the preconceived thoughts or conceptions
Yeah.
like myself did. I just was like, oh, cancer, cut it out, like, and that was it. So,
Yeah.
it's like the NBC, the more you know. Do do do.
Yes. And you can't cut it out with melanoma. That's not how melanoma works,
Yeah,
which
it just
I mean,
pisses
for
it
me,
off.
it was a crash course, and I didn't
Yeah,
know systemic versus targeted treatment. I didn't
me either.
know, um, you know, any of it. And my first doctor, Dr. Pesto at Memorial Sloan Kettering, just incredible doctor, and he did such a good job of educating us. Even
Yeah,
if my dad was sitting in the room, um, because obviously my dad as a doctor had a greater breadth of knowledge than either of us did. But Dr. Pesto was so kind and just patient with us as we were, as a patient, as
that
a
goes far.
builder or a recruiter, like you don't know this shit, like and you shouldn't. Um,
It's making it personal, because it could be their family or themselves, and
mhm.
it's, we're humans, and it's humanizing it. And there's so much in the medical field when you go see a doctor and they're just herding cattle, and it's like,
Yeah.
what the fuck, like, come on. So I'm so glad that you were able to, like, I love hearing, I follow you, I've met you, I read your stories, and it's rare. And so for the Rare Disease Day, cheers to you, cheers to Till, cheers to anybody that's listening to this, that there's a chance you could be that chance, right? So,
Yep.
well,
Yep.
thank you so much, Katie. I appreciate you more than anything. We'll shoot you a text, and follow up some more. But
Awesome. Yeah.
anything else you
Always
want to
excited to
say?
connect with you. No, I mean, just happy to be here and appreciate the work that you're doing and creating awareness and spreading hope.
Absolutely. Till also means today I learned. So there we
Ah,
go.
there you go.
All right, Katie. Well, thank you so much. And until next time, we'll see you.
See ya.
All right. Take care. Oh, where's the button? All right. That concludes today's episode of Till Talks with Chris White, as we talk tills, tumor-infiltrating lymphocytes, and all advanced cell therapies. I want to take this time to thank today's guest for joining in and participating in the conversation, and also take this time to remind our listeners who have not done so already to follow, comment, subscribe, share, and smash that like button. Want to send love out to everybody and thank you for all your support. If you have interest in joining in the conversation on TIL Talks, or if you would like to sponsor or be a part of the conversation, please reach out to mucosamelanomasurvivor.com and or yourtillspeaker.com. Sending love and always peace.